Hi, my name is Nicole Vargas and I'm talking about the sickle cell anemia. Definition. Sickle cell anemia is a hereditary blood disease in which a sulfury red blood cells form crescent shapes and scribed when they are not bound to oxygen in the bloodstream. This is caused by an abnormal type hemoglobin called sickle hemoglobin. And is a protein that carries oxygen and is part of red blood cells. And what does sickle cell anemia do? Sickle cell anemia makes red blood cell skitty, and crescent moon shaped, makes affected red blood cells clump together and blockade blood flow in blood vessels, and shorten lifespan of red blood cells to 10 and 20 days. Healthy red blood cells can live up to 19 and 120 days, and make it harder for bones marrow to replace dying red blood cells due to short lifespan of the blood cells. And this graphic describes what the sickle cell anemias do in the blood, in the torrent sungen.
Sickle cell disease, also called sickle cell anemia, or just sickle cell, is a genetic disease where red blood cells can take the shape of a crescent, or sickle, and that change allows them to be more easily destroyed, causing anemia, among other things. Sickle cell disease is caused by defective hemoglobin, which is the oxygen-carrying protein in red blood cells. Hemoglobin is actually made up of 4 peptide chains, each bound to a heme group. Different hemoglobins have different combinations of these chains. Hemoglobin A, or HbA, made up of 2 alpha globin and 2 beta globin peptide chains, is the primary hemoglobin affected in sickle cell. Specifically, the beta globin chains end up misshapen. And this is because of a mutation in the beta globin gene, or HBB gene. Sickle cell is an autosomal recessive disease, so a mutation in both copies of the beta globin gene is needed to get the disease. If the person has just one copy of the mutation and one normal HBB gene, then they're a sickle cell carrier, also called sickle trait. Having sickle trait doesn't cause health problems, unless the person's exposed to extreme conditions, like high altitude or dehydration, where some sickle cell disease-like symptoms can crop up. What it does do is decrease the severity of infection by Plasmodium falciparum malaria. So in parts of the world with a high malaria burden, like Africa and pockets of southern Asia, those with sickle trait actually have an evolutionary advantage. This phenomenon is called heterozygote advantage, and its unfortunate consequence is a high rate of sickle cell disease in people from those parts of the world. Almost always, the sickle cell mutation is a non-conservative missense mutation that results in the 6th amino acid of beta globin being valine instead of glutamic acid. A non-conservative substitution means that the new amino acid, valine, which is hydrophobic, has different properties than the one it replaced, glutamic acid, which is hydrophilic. A hemoglobin tetramer with 2 alpha globin and 2 mutated beta globin proteins is called sickle hemoglobin, or HbS. HbS carries oxygen perfectly well, But when it's deoxygenated, HBS changes its shape, which allows it to aggregate with other HBS proteins and form long polymers that distort the red blood cell into a crescent shape, a process called sickling. Conditions favorable for sickling include acidosis, which decreases hemoglobin's affinity for oxygen, and small, low-flow vessels where red blood cells' hemoglobin molecules have plenty of time to dump lots of oxygen molecules. Repeated sickling of red blood cells damages their cell membranes and promotes premature destruction. Since this happens within the vasculature, it's called intravascular hemolysis. This destruction of red blood cells not only leads to anemia, which is a deficiency in red blood cells, but also means a lot of hemoglobin spilling out. Free hemoglobin in the plasma is bound by a molecule called haptoglobin and gets recycled, which is why a low haptoglobin level is a sign of intravascular hemolysis. Recycling of that heme group yields unconjugated bilirubin, which at high concentration can cause scleral icterus, jaundice, and bilirubin gallstones. To counteract the anemia of sickle cell disease, the bone marrow makes increased numbers of reticulocytes, which are immature red blood cells. This ends up causing new bone formation, and the medullary cavities of the skull can expand outward, which causes enlarged cheeks and a hair-on-end appearance on skull X-ray. Extramedullary hematopoiesis, which is red blood cell production outside the bone marrow, can also happen, most often in the liver, which can cause hepatomegaly. In sickle form, red blood cells tend to get stuck in the capillaries, called vasoocclusion. Starting in infancy, they can clog up blood flow in the bones of the hands and the feet, called dactylitis, or swelling and pain of the digits. Later, they get stuck in other bones, causing sickle cell pain crises or avascular necrosis of the bone.
Diagnostic. Who is sickle cell disease diagnostic? Diagnostic is made by a blood test. The blood sample is analyzed. Diagnostic. How is sickle cell disease diagnostic? Diagnostic is made by a blood test. The blood sample is analyzed to see what type of hemoglobin is present in the blood, using a test called hemoglobin electrophoresis or the other methods. This can diagnose most case of sickle cell trait and sickle cell disease. Sometimes the result is unclear and extra tests such as DNA genetics tests are needed. Result. Targeted therapy based on the pathologic mechanisms of sickle cell disease that result in organ dysfunction, and painful episodes include hydroxyurea and L-glutamine, crescentlucibine, and the other drugs that are currently on the market or are on the verge of becoming available. These agents have the potential to improve survival and quality of life for individuals with sickle cell disease. Also, this concept is stem cell transplantation that to date is the only curative approach for this disease, as well as the current status of gene therapy.
Well, it's very exciting because, until now, the only potential for a cure for sickle cell has been a transplant, a bone marrow transplant from another patient, where another patient's cells are collected. Gene therapy uses the patient's own cells, and so this eliminates the risk of something called graft versus host disease and some of the potential for immune rejection of another person's cells. So gene therapy means that theoretically anybody with sickle cell can use their own cells to undergo gene therapy and potentially have a curative option. Now, of course, we're far from the time that everybody can sign up, but these early results are really very encouraging.
It's inspiring. You know, younger kids look up to the older kids who do. You know, you have to be brave for them. So I was being brave for my brother so that he wouldn't have to do it. There's millions of kids like him, millions of adults like me who, you know, want to, I guess, experience a normal day, I guess.
Methods. This review examines several treatment modulation and new drugs developed since the late 1990 that have been used to improve outcome for patients with scale size disease.
Sickle cell disease is an inherited blood disorder. It affects millions of people worldwide and is the most common inherited blood disorder in the United States, affecting about 100,000 Americans. Screening for sickle cell disease is typically done at birth. People with sickle cell disease have abnormal hemoglobin. Hemoglobin is the protein in red blood cells that delivers oxygen to all cells in the body. The abnormal hemoglobin causes the red blood cells to become rigid and take on a sickle or crescent shape. The sickled red blood cells get stuck in the body's small blood vessels. As a result, cells and organs can't get the oxygen they need, which can lead to organ damage and failure. It can also cause episodes of pain, known as crises. The most common treatments for sickle cell disease include antibiotics, pain management, IV fluids, blood transfusions, hydroxyurea, and surgery. Transfusions deliver healthy red blood cells to the body. However, they also cause extra iron to build up in the body, which can damage organs and cause abdominal pain, weakness, fatigue, and joint pain. Patients who receive ongoing transfusions also must take medicines to remove the excess iron. Bluebird bioscientists are researching a possible gene therapy treatment for sickle cell disease. In the lab, a functioning copy of the hemoglobin gene is packaged into a lentiviral vector. The vector contains a small number of parts from the human immunodeficiency virus, or HIV, which is very effective at moving genes into cells. The vector has been changed so it cannot cause HIV infection. The scientists will use the patient's own blood stem cells, which are collected from a bone marrow harvest procedure. In a lab, the blood stem cells are separated from the liquid bone marrow. Using the lentiviral vector, scientists will then insert the functioning copy of the hemoglobin gene into the DNA of the collected blood stem cells. Inside the body, chemotherapy will be used to remove existing stem cells to make room for the new ones. The modified blood stem cells will then be returned to the patient's body, where they are expected to grow and produce new cells that contain normal hemoglobin. The goal is for the modified stem cells to become a permanent source of healthy red blood cells that do not sickle, preventing organ damage and other complications.
In conclusion, this example and of news approach to the treatment of patients with sickle cell disease sample some of the current attempts to moderate or cure the disorder. Interest in sickle cell research has blossomed and now can offer hope to the many individuals living with the disorder around the world. Many more clinical trials need to be united and subject to more strenuous examination and analysis than have been used in the past. Effort will have to be made to offer this disease the therapy in less advanced countries where the majority of individuals with sickle cell disease live. And this institute now appears more possible than ever before.
Hey everyone, in this is where we're talking about sickle cell disease. So what is sickle cell disease? Well, it is a group of hereditary blood disorders with characteristic sickle-shaped red blood cells. So you can see here, the cell on the right is a sickle-shaped red blood cell, and the one on the left is a normal red blood cell. Now, sickle cell disease is inherited and is actually inherited in incomplete autosomal dominant fashion. So on the right here in the schematic, you can see that an affected individual has two copies. They're homozygous, so they have two copies of the affected allele. So they're considered affected. So and individuals with only one allele are considered unaffected carriers. So it appears to be recessive condition, but in fact, even individuals with one of the affected alleles can for sickle cell disease. And the other portion of individuals, the individuals with only one affected allele, are considered heterozygous, and they are considered to have sickle trait. So again, they're very slightly affected, but not as much to the degree as someone that has homozygous hemoglobin SS. And individuals with the sickle trait or heterozygous individuals, about 7 to 8% of African Americans have sickle trait. Now, the sickle cell mutation appears to be protective against malaria, so that's the reason cells coming in, and they will be essentially cleaning up a lot of these red blood cells, a lot of these sickle. These patients, when you look at a blood smear, the cells can have, or the cells can be polychromatic or have polychromasia. So when you look at them, they can be different colors. So on the blood smear, you can see here's some normal cells, and you can see these other cells that are different colors. So that's essentially what polychromasia means. both chronic leg ulcers and proliferative retinopathy. So not all of these can occur in every patient, but some patients can have some of these other complications. Some of them are due to the and can prolong survival of patients with sickle cell disease. Another possible treatment is hematopoietic cell transplantation. This is thought to be usually thought to be the only cure for sickle cell disease, and it's usually performed only in individuals less than 16 years old. And blood transfusion can be performed in patients with sickle cell disease because, especially in patients with severe anemia, if they have very low hemoglobin, and because of many of the symptoms I've mentioned before, due to vaso-occlusion, pain management is very important in patients with sickle.
And thank you.